Hello friends, do you find it difficult to calculate GIR or glucose infusion rate? If you are a resident or nurse working in NICU and you frequently need to calculate GIR, then this video is just for you. So whenever you encounter a neonate with hypoglycemia, then you need to start them on continuous glucose infusion rate or GIR. But the mere thought of calculating GIR makes you nervous or uncomfortable because it involves math. And as a doctor, we don't like math too much, right? But thankfully, if you get your basics right, then it is not that difficult either. So what are you waiting for? Let's get started. So friends, this is the formula for calculating GIR, and unfortunately we have to memorize it. GIR is equal to percentage of dextrose into daily fluid requirement in ml per kg per day divided by a factor of 144. So GIR, this portion we have to decide. We usually start with a GIR of 6, then titrate it according to target blood sugars. The second component, the fluid component, fluid requirement, which is also known to us. So if we fill these parameters, then this equation can be rewritten as GIR into 144 divided by TFR or fluid requirement, which should be equal to percentage of dextrose. So now if you fill all these parameters, you will get your desired percentage of dextrose. Let us learn this with an example. So if you take a GIR of 6 in a neonate with a total fluid requirement of 120 ml per kg per day, this will come out to be 6 into 144 divided by 120. This will give you a factor of 7.2%. So far so good. So we are done with the first step of GIR already. Now the question is that how to get this 7.2%, because the commercially available dextrose comes only in concentration of 5%, 10% or 25% concentration. So obviously we need to mix these available dextrose concentration to get desired concentration. In other words, to get a desired dextrose concentration, that is D, you need to mix one higher and one lower concentration of dextrose together. So now, how much amount you need to mix of each dextrose solution, you can get this with this easy formula. So the proportion of lower dextrose will be equal to H minus D divided by H minus L, where H is the higher concentration of dextrose, D is the desired, and low is the lower concentration of dextrose. So suppose you want to get a dextrose concentration of 7.2%, you can mix a lower dextrose, say 5%, with either 10% or 25% dextrose. For sake of simplicity, let's take 5 or 10% in this example. So if you fill all these values in the given formula, you will get fraction of 2.8 by 5, right? Or roughly you can say nearly 3 by 5. So now you know your fractions. So if you need to give your patient 200 ml of fluid, you can need 3/5 of 5% dextrose, that is 120 ml, and remaining, that is 2/5 of the 10% dextrose, which will be 80 ml. So that's all. You have successfully calculated GIR in less than 2 minutes. But wait, there is more. What if I tell you that you don't even need to remember this basic formula or do this calculation anymore? Yes, it is true. We don't need to remember this formula. What we need is that we can done away with this formula. All we need is this glucose rate calculator. This is a very simple tool to calculate GIR and is given in most of your textbook, including Cloharty. But for some strange reason, residents always tend to overlook it. So how to use this? Very simple. You just need a ruler or anything with a straight edge. So suppose you need to start a GIR of 6 with a TFR of 100. So you just need a scale and keep the edge so that it touches 100 TFR and 6 GIR, right? And now whatever value the edge of your scale is intersecting the glucose line is your desired percentage, which in this case is roughly 8.5%. Easy, isn't it? Let's take our previous example only, right? So where we took a GIR of 6 and a TFR of 120. So if we repeat that example in this case, we will get a desired percentage of dextrose 7.2. This is exactly what we got with our calculations as well. So here you go. You just need to take a print of this GIR calculator and paste it in your working area, and this will take care of everything else. Thank you for watching, and bye bye.